Hello, everybody. I want to welcome you to the latest in our series of ENO Center for Transportation webinars. My name is Robert Puentes. I am the President and CEO of ENO. And thank you for bearing with us while we had a little audio issues getting ready, but we are ready to go now. And today I'm really happy that we have three leaders in the transportation space here to talk with us about public transit innovation during this time of COVID. As we all know, public transit in the United States is going through some tremendous challenges as a result of the global pandemic. Concerns about public health and safety, both for transit riders and also for transit workers, has crippled systems literally from coast to coast. Low ridership means less revenue for operations at a time when actually expenses in some cases are increasing, as agencies are having to do things like enhanced safety protocols and new cleaning regimens. At the same time, we are seeing how absolutely critical public transit is playing their role as a backbone of urban mobility, particularly in moving essential workers and frontline personnel. In response, agency heads are being forced to change how they operate, but we're seeing that change can also be very difficult. And especially during this challenging time, it may be very difficult to think about new ideas. Then again, it may be actually more important than ever that we do so. So to help us think through these issues, I'm joined virtually by three standout transit leaders. Alice Bravo is the director of Miami-Dade Transit. Gary Thomas, the president and executive director of Dallas Area Rapid Transit. And Tina Quigley, until recently, was the CEO of Las Vegas's Regional Transportation Commission, and now on the board of Waycare. For those of us who are joining, those of you who are joining us live, you can use the questions function on the control panel of the webinar website. You can send in questions or comments for any of the panelists. We're going to take those as we go through this discussion. You don't have to wait until the end to submit questions. But first, I'm going to ask one question for the whole group, and then we'll open it up for some back and forth. So we'll start with Alice, and then Gary and Tina. So prior to COVID, transit, I would say, was going through a very dynamic and interesting time. There's a lot of changes that were happening in transit. There were new partnerships, new technologies, new approaches for doing things. Then COVID hit, and obviously everything changed. So how does transit remain innovative during a time of really substantial challenges, ridership loss, funding, workforce safety? And is this the time for transit to be pursuing new innovations? Start with Alice and then go down the line.
Well, I think absolutely, and thank you. It's a pleasure to be here. Certainly before the virus hit, our ridership was rebounding. We had purchased and implemented hundreds of new buses into our fleet, new metro rail trains to replace our fleet. So it was a promising time for our ridership. And with this, obviously, the ridership plummeted. So I think this is absolutely the time for innovation. We're dealing with a public that's concerned about their public health safety. They still need to use public transit to get to work, get to their appointments, etc. And so not only do we have to be innovative, but we have to be quick, and things change from week to week, and we have to figure out how to respond to it. And we actually, because of the COVID situation, implemented something we had been thinking about trying for some time, which was replacing our nighttime routes with basically an Uber-Lyft partnership. So on what we had 8 overnight routes, so we put up special signage, and between midnight and 5 a.m., you either call a phone number or you go to the Uber Lyft app and put in a voucher code. And so with partnering the private sector, we actually improved the service during those hours at a lower cost. So it's something we wanted to try to do at some point, and so this was a good opportunity, and because of the emergency situation, the procurement rules are more flexible, et cetera, and we were able to do something like that. So, the whole question is, what do you do so the public feels safe? How do you respond? And as ridership declines and then increases the next week, what other flexibilities do we introduce just so we can keep pace with the changing dynamic?
Gary?
Great, thanks, Rob. Really appreciate the opportunity to be here. Thanks to ENO Trans for hosting this afternoon. Certainly, I think this period has emphasized how important transit is to many of our communities as we look at our rider base and who's riding today. And for our agency, we're about 50% down, but the 50% that are still riding are the people that absolutely look to public transportation as how do they get to their essential jobs, how do they get to the grocery stores, how they get to where they need to go. And so probably now more than ever before, it's been emphasized as to how important public transportation is. From DART's perspective, we were already in the actually in the process of pivoting more toward mobility as a service before all of this happened. So we were already looking at how to really provide trips to our customers that they wanted to take. In other words, we weren't really trying to dictate how people took their trips, but asking the customers what is most important to you. Something that I think as you look back on the history of transit, we do customer service great. I mean, but our version of customer service is making sure that our trains and buses are clean, that our people are friendly and polite, and that we do what we need to do. But our routes are fixed. I mean, by definition, that's what we are. And so now in a time, in pre-pandemic times, when people were expecting things to happen immediately, you do, and maybe now even more than before, when you do your order on Amazon, you expect it this afternoon, not tomorrow or the next day. And transit was certainly going through that transition as well. So we were already pivoting using the GoPass platform, an app that we developed in 2013, quite frankly, because we wanted a low-cost entry into mobile ticketing. We couldn't afford a smart card, so we said, for a fraction, really a mere fraction of the cost, we developed this app that was a payment system without having to go through the smart card. Now, looking back, we looked very smart going to the smartphone technology 7 years ago, but it was purely accidental. But the benefit now has been that we've been able to continue to grow that, and now more than ever, it gives us that opportunity to pivot even quicker than before. When we look back on this period of time in history, it will be a blip. I mean, it will be just seconds in the scheme of things. And I think people will look back and say, how did we take advantage of it? What did we do during this time period to really change the way people move around our communities? Yes, we know that a lot of people are working from home today. We get that. Is that going to continue? This isn't the first pandemic that's ever hit our world. And, the world has had pandemics before. Many of our generations aren't really familiar with that, but this isn't the first time. And each time it's happened, something's changed in the world. And I think this is the opportunity for transit, especially, to pivot a little bit faster, a little bit more quickly, to really meet the needs of our customers as we move forward.
Great, thank you, Gary. Tina?
All right, so I want to start off by saying I think it's an insanely exciting time in transit, and I hope that's not lost on us. I mean, like Gary said, this is a blip. We have lost ridership, and we may not get that ridership back. In fact, I was just reading the Ford Mobility did a survey of 1,000 people, of which only 36% of people said that they would be coming back. But this is forcing us to accelerate and pivot, as Gary and Alice said. And I can't help but just be kind of excited about it. We already knew that transit was still kind of stuck in, our grandfather's transit mentality. And we were, I think, as an industry, kind of having a tough time at pivoting. This is forcing us to have to pivot and to have to accelerate. And more importantly than anything else is to really understand, to set benchmarks. The transit industry, we haven't been really great at setting benchmarks for ourselves as it relates to which services and which customers we needed to be serving as the highest priority. We have access to data now, like no other we've had pandemics in the past, we've gone through economic downturns in the past, but you guys, we have access to data like no other generation has ever had. And we're just in the beginning phases of it. Like you mentioned in the intro, Rob, I am on the advisory committee, the advisory board for a company called Waycare, which I love because it's forcing me to really learn what the abilities are out there, the ability to aggregate data, synthesize it, analyze it, collect it from crowdsourcing, from infrastructure sensors, and then to start to predict where those congestion points are going to happen, where accidents might happen, and then transmit that, relay it to transit agencies so that their schedules and hopefully their customers get real true up to the minute information relating to their very important trip. So, and I could monologue forever. I just get so excited. I think all of us need to be somewhat excited about this moment in time that we are in and our industry's in.
Well, I can tell you that point seemed to resonate. There's a whole bunch of comments that have popped up here. So I'm going to go to one of the comments early because it relates to something you just talked about, Teen, and something I wanted to get into at some point. I mean, despite my bleak introduction, right, about ridership and things, there is some positive things that are happening. I think it is being used as I hate to say silver lining or an opportunity, but a time to do something different. One of those things is about these measures of success. So ridership obviously is, the trends look very different, but we know that transit is moving, as Gary was saying, essential workers, right, people who really need it. How should we be thinking differently about measures of success for transit pre and post COVID? Tina, let's start with you. You talked about data and kind of new benchmarks. What should we?
Okay, so summarize that question again for me. What benchmarks should we be focused on? Oh my gosh, on-time performance is certainly always going to be a challenge because there's always construction, there's always congestion. But our ability at this point to be able to communicate with our customers real-time information, the fact that we haven't truly gotten there, some cities have gotten there and they're doing a really great job. And my city's one of them, just so you know, Las Vegas. MJ Maynard, the current CEO, is doing an amazing job. But that's just inexcusable. That it's inexcusable that we haven't made that the #1 priority. How scary would it be if you were a commuter trying to get to work, or a shift worker? In my town, we've got lots of service employees, and never really feel confident that the information you're getting is true and that you're going to get to work on time. To me, inexcusable. That's one of the top performance metrics that we should be working on. Maybe we can't be on time, but you darn well better be communicating to your customers the status of their ride. Okay, that was one. I could probably go on. The other thing is that including the community in using data to figure out which routes are not productive. We got to move away from establishing and keeping routes for political reasons. And I know it's easy to do because I don't have a board right now, but you have got to make these decisions based on metrics. You are still stewards of taxpayer dollars, even though you've got this constant revenue stream of generally sales tax, which is down as well, but you are still stewards, and you should be working towards performance metrics that maximize the use of those taxpayer dollars. And so you have to include your community as well in these decisions and provide them the data to help get to the right decisions.
And I guess that also then will relate to Alice, what you're talking about with the Go Nightly service that you've replaced. This, maybe these are not the right words, but that the late night routes, probably underperforming, have now been supplemented or are now enhanced by TNCs. Can you describe that a little bit more? Was that something that happened before COVID, or something that happened since then?
Well, Miami-Dade County is a big place, and we have 94 bus routes. So it's hard to cover all the areas. So we've always been, I think in the last year, we've been looking at other ways that we could service the low density areas where you can't justify a bus route. So people have access to some type of transit and bring them to those high frequency corridors. So we talked about partnering with the TNCs for some type of voucher program. So once we started making our adjustments due to COVID, we realized we had these low ridership routes in the middle of the night, and now during the day, because of social distancing, we didn't have enough capacity on the higher ridership routes. So it was a matter of how do we reallocate our resources. we are limited in drivers because drivers are quarantined. So to maximize the benefit we were deriving from our resources, we said, let's replace these late night routes with the Go Nightly service. And so basically, along these 8 routes, the bus stop signs were supplemented with an additional sign, and it says between midnight and 5 a.m. You can go on Uber or Lyft or call this phone number if you don't have a smartphone, and a vehicle will take you on your ride along this corridor and up to a quarter of a mile away. So we do have a radius around each corridor for service. And basically, we were able to cut our costs dramatically because the number of people actually utilizing these routes is maybe like 60 a night. So as we look at revamping our bus routes under what we call the Better Bus Project, there were areas where we were going to do the same thing, reallocate our resources to those high frequency, higher ridership routes, and then there were going to be low density areas where maybe less or no service. So this is something that at some point we want to introduce during the daytime as well, so that anybody anywhere in the county has access to some type of transit to get to those high frequency bus routes. So this in a way is a pilot project for us.
Do you have any preliminary insight of what has been going? Any insights on success so far?
Well, we consider it successful in terms of being able to service everyone that calls in or goes through the app. And what we found early on, that for the people that don't have the smartphones, it was important that we provide our vehicles. So we actually contract out our paratransit to a private company that has a fleet of vehicles. So when someone does call the phone number because they don't have a smartphone, those calls go to the drivers. So we have 15 cars on basically standby from that company. We noticed that the Uber and Lyft drivers were just not very patient about trying to find someone that the app couldn't take them to directly. So the paratransit drivers are more sensitive to finding someone and an address, et cetera. So that was like the bug that we had to work out at the beginning. But otherwise, we're able to transport everyone that makes a request.
That answers the question, I think, around ADA. There must be 5 questions on here from folks asking about how you deal with the ADA style requirements. So you're saying that you contract out with a separate provider.
Right. So that paratransit provider, their vehicles are already equipped. They meet all the requirements, and so those calls get directed to them.
I just will reiterate, Las Vegas does the same thing. We were actually able to cut our paratransit costs for ambulatory passengers by 50% by partnering with Lyft. And then we did, MJ actually created a partnership with another company who just does the wheelchair accessible vehicles. That's more expensive, but the cost benefit when you aggregate the cost for paratransit there's an overall cost savings.
Tina, we did the same thing in Dallas. We went to a broker model for our paratransit services, where the contractors actually have several subcontractors, and they determine what's the best fit as far as vehicle and customer to put out there. So it works well, and it saves us money and works better for the customer as well.
Carrie, I'll stick with you just for a second. So this isn't, as you said, this isn't your first rodeo, excuse the pun, but you, in 2014, the region was hit with an Ebola outbreak, right, as I recall. So how did that, the work back then prepare the agency to deal with the challenges that you're facing today?
So you're right, Rob. In 2014, there was an Ebola outbreak, I guess, if you will, globally, but it really kind of centered on Dallas in the United States. And so it caused some very tense moments. Ebola maybe wasn't quite as contagious, but much more deadly when contracted. And so what that caused us to do, not knowing what the future held, specifically to Ebola at the time, but as we were just going into a bus procurement stage, and we're actually basically turning over our entire bus fleet at that moment in time. So roughly between 600 and 700 buses. We actually purchased all of our buses with either UV light air filtration systems or ionization filtration systems on our buses. So pretty much our entire fleet now has either UV air filtration or ionization filtration systems on our buses. So again, while the Ebola outbreak fortunately didn't go any further than it did, it also put us in a really good position from an air filtration standpoint. Of course, lately we've read about the number of air changes is quite frankly more often, more frequent on transit vehicles than it is in other places. And in our case, not only do we have the frequency of the air changes, but we also have the air filtration systems on all of our fleets. So again, fortunate from that standpoint, and it goes along with all the other high touch cleaning that we're all doing. One of the things though that we did have to correct at the very beginning of the pandemic outbreak was that the definition of cleaning was different throughout our organization. And so as we went through that, people say, well, we clean these buses or we clean these trains so often. Well, as we started getting into that, what cleaning meant to different people, we found it was very different. And so we had to come up with a standard, a vocabulary on what that really meant, and then make sure that we were consistent on all our vehicles. But back to the air filtration, we're very fortunate to have our entire bus fleet to have some type of specialized air filtration system.
Oh, it kills me to always have to tell Gary that he's such a great forward-thinking leader, because I love to make fun of him about stuff, but he always plays the technology and innovation card, and he's like 5 steps ahead of us.
Sometimes it's just good to be lucky, Tina.
Preparation. There's a couple of questions around culture and innovation I want to get to in just a second. But a couple of folks are also wondering, maybe a little off, but around suspension of fares, right? So I know that many agencies have gone to different kind of fare collection systems. Sometimes it's contactless, sometimes it's honor systems, rear board, bus entering and things like that. Did any of you consider suspending fares, at least in the short term? Is this something that you think is in the future? How do you think about fare collection going forward?
Well, we suspended fares very, very early. We participated in calls with Seattle, which was one of the first cities hit. And that was a measure to basically keep the passengers further away from the bus operator. So we suspended fares and implemented the rear door boarding. And I just want to say that that's probably going to continue so long as our numbers are where they are. At one point, I guess towards the end of May, our numbers were way down for Corvin, and it looked like we were out of the woods. And then there was talk of maybe re-implementing the fares a few months later. So to prepare for that, we were installing polycarbonate doors that would fully enclose the driver compartment. Right now, they only have a partial plexiglass door. So we have about half of the fleet now fitted with those doors. But so long as the numbers remain where they are, we're going to keep fares suspended and the rear door boarding. And something to mention, maybe the most demanding part of all of this is the communications. I mean, we're putting out all kinds of different communications. We had gone to contactless and rolled out a new mobility payment app, and our logo was Go Miami-Dade. We changed that to Don't Go Miami-Dade, essential trips only. So that hurt me to change that to our line, but so the communications, all of a sudden face coverings are required, and reinforcing how to wear the face coverings. They must cover your nose. So the communication aspect is probably one of the greatest challenges, and keeping that fresh and grabbing people's attention.
I have a question for both Alice and Gary, because you're here in Las Vegas. I know I'm talking with MJ. We, because of the free no fare and rear door loading, we had a homeless problem and ended up getting a lot of complaints from our standard ridership. Just curious to know how you dealt.
So in our case, Tina, we did not go to free fare. We did go to rear door boarding, and we actually put barriers up in the buses so you could not go forward of the yellow line. And we moved the yellow line back 6 feet from the operator. And we, like Alice, we had partial plexiglass doors. We put up, for lack of a more technical term, shower curtains. But we still, while we didn't enforce fares, we never said free fares. So if we had someone behaving badly on the train or bus, we did have some ability to enforce fares at that time and ask people to get off the train or bus. And then we've replaced our shower curtains with full plexiglass shields for all of our operators. The entire bus fleet is outfitted now. And we went back to front door boarding when the governor started mandating masks. And so that allowed us to then, again, not only collect fares, but enforce the fares and hand out masks to folks as they got on if they didn't have one. We're actually in the process of outfitting all the buses now with mask dispensers that we're having fabricated, and should have those done in another few weeks. So
Got it.
We went through a shower curtain phase as well before the doors.
All right, well, I got Gary on this one because we retrofitted all of our fleet with the enclosures, oh gosh, probably about 4 or 5 years ago for driver protection purposes.
Yeah.
And we had a bunch of commenters saying that the Europeans have done this years before too. So I guess it actually gets to the point earlier that we learn from these things, as you know, we talked about with the crisis 2014 in Dallas. We learn from those. We instill those new ideas. We replicate those, go across the country, to go across the world. So I think we've clearly seen that. I want to, before we go to the other question, I want to stick with the question of communications, just because there's a lot of folks asking about this. And Alice, you were talking about communicating new kind of new approaches to riders, and I can't imagine what it's like for transit agency heads to have to ask people not to ride the system. It's quite a different time. But Gary, particularly for you, folks are wanting to know about the cleaning regimen. How do you communicate everything that the agencies are doing? I don't think there's enough appreciation out there about how much is going on. And just speaking from here in the Washington region, a tremendous amount of this new cleaning activity that's going on, I think needs to be communicated better to folks to give them assurances that things are safe.
You know, and Rob, that's certainly that's always been one of the challenges in transit, is we don't tell our story very well. And so we typically don't get out there and really emphasize the fact that all of our buses do have this special filtration, air filtration systems on them. But we have really stepped up our communications. At the beginning of July, we rolled out a marketing campaign to let people know what we're doing, even though we've been doing that since late March, communicating how we're cleaning. Every train gets cleaned every 60 or 90 minutes in the high touch areas, what we're using to wipe them down. We have foggers, we have electrostatic sprayers. We've hired 30 additional people just to clean buses and trains throughout the day and throughout the week. And again, it's that constant communication, because as much as we think we're telling that story, if I go out and ask my neighbor tomorrow, do you know how much we clean buses and trains? He's going to say, no, I didn't know you cleaned them at all. But that's the challenge, of course, that we all face, is how to get that message out.
And I have a question, and this is your show, I get it, Rob, but I'm wondering, certainly we're at a point where we are going to have to cut routes, and hopefully we do this, we're using data and we make really wise decisions. So as we start to, which gives us the opportunity to kind of reinvent ourselves as we do grow back, as we do become more a part of and integrated into the community fabric. What I forgot what I was going to ask. What do we see ourselves doing in terms of exactly what you said, like building our credibility again, communicating people know that we are a credible, reliable, clean, safe system, because we don't do a good job telling our story.
You know, there's an article in was it the New York Times yesterday or today that talked about maybe transit isn't the epicenter of the virus. And that article actually got picked up by a couple of the news tabloids around here, and they reprinted it, and they offered their thoughts and opinions on it. But at least it's out there, and people are starting to pick up on that and say, you know what, transit's certainly a lot safer than bars and gyms. And so maybe there's still hope, but fortunately other people are getting on board telling our story now as well.
I think the important thing is that the riders that we have, they're very willing to comply. We've had very few issues with people wearing the face coverings. People want to feel safe, so there's one thing that we're cleaning the buses 3 times a day and the stations and everything. So, but people have to perceive that they're safe, so we're going to conduct a user survey and figure out how to get that message out in the right way for the different target market groups, because we know what we're doing, but people have to feel safe. And so right now we have the social distancing. We use every other seat on the buses and the trains. We don't allow anyone standing. That has limited our capacity significantly. We've brought in additional vehicles. And so basically every time we do that, contract a new company to bring additional vehicles, we put out a press release, we message that. So people know that on a day-to-day basis, we're looking to make the service better and better. And to touch on a point that you had earlier with regard to the homelessness or riders, that is affecting our capacity. So we have talked about reinstating fares for that issue, but that's not on the horizon.
So one of my thoughts is that when we talk about communicating, we do a lot of press releases, we do a lot of social media, but the thought of being able to actually on the bus, maybe through the header sign or some type of signage as you are getting on the bus, and I know that MJ, again, the CEO of Las Vegas, is starting to look into this, experiment with it, but like right then and there at the point of contact with our customer, they can make a decision. They know, they feel confident getting on that bus, that particular moment in time, that they can feel confident. And then the other thing is having the ability to, in terms of capacity and buses and knowing, when do we need to put more buses out because we can't have as many people on a bus. Technology to give you live up to you as the operator and our customers up to the minute knowledge as to how many people are on that bus.
Right.
And that allows you, the operator, to know whether or not you need to dispatch, but it allows the customer to know, do I want to get on that bus? That's the kind of data that we deserve, our customers deserve in our community. So,
well, through a little innovation of our IT department, we actually figured out how to get data real time from our passenger counters on the buses. So the supervisors in the office have real time information, how many passengers are on each bus, and they'll actually communicate with the bus operator and say, hey, don't stop at that next stop, bypass, because we're going to deploy a supplemental vehicle behind you or ahead of you to pick up those passengers, so that the operator doesn't have to deal with, confronting passengers at a stop and say, okay, only half of you can get on and that kind of thing. So we haven't made it available to the public yet, but it has been part of our operation for several months now.
Rob, that's the kind of thing that is so fun, and not to, certainly I don't want to downplay the pandemic, but that's the type of thing that's acceleration of those types of amenities and really important information to consumer confidence are going to help us as we pivot, as Gary said.
Indeed, and judging from the questions and the comments, this is what people are looking to talk about, are these very practical things that you all are doing in these regions, how you're responding, what lessons can they take. I think, Team, to your point earlier, this is it remains a dynamic time, right? And places are looking for ideas from other places and trying to replicate good ideas, improve upon them, learning what works, what doesn't work. And I mean, look, just judging from the questions that we've got here, a lot of practical interest in safety and cleaning, the fares, I mean, all those kinds of things. So I think we at too, all of you do a better job in getting a lot of this stuff out, because we know that there's innovation that's happening. We just need to make sure that other places are able to take advantage of that. So let me shift a little bit and get into this larger question of innovation. So each of you were at the helm, or team, we're at the helm of innovative agencies. how do you instill that in an agency culture with your staff? How do you give staff and decision makers the comfort that they're able to do things that are innovative, that are taking risks, that are taking chances, and that they give them the freedom to do so?
Don't yell at them when they mess up, right?
No, and Rob, that's going to be a really regional question for every single transit agency. You meet one transit agency, you've met one transit agency, because it's a geographical culture. There are just cities that are more risk tolerant, and Las Vegas is one. I mean, we're a gambling community, so there's always new technologies, and there's this understanding that you got to keep looking forward. So. And then the other thing is that internally, sometimes the younger transit agencies are much more agile than older legacy transit agencies. So there's not a one size fits all, but inevitably, in my experience, is that you really need to be communicating with your board. Your board has got to have that comfort level and you share with them every step of the way what the risks are and what the wins are going to be. And there are some tremendous wins in terms of cost effectiveness and safety when you start to adopt, and you can do baby steps, you can do pilots. And then once you feel confident with your board, yeah, like Gary said, you can share it with your staff, and there's nothing more inspiring than a call to action and trying something new and being leading edge on stuff.
Rob, from our standpoint, it was really kind of setting the tone, this is what I want to do. This is what we need to figure out how to solve from a customer perspective, and making it easier, and then let the team run with it. Give them the latitude to really run with it, and you have to have the right team. Build that team, and then give them the authority. Our chief innovation officer came out of GameStop, and so he's not a transit person by any stretch of the means, but he understands technology, and he understands the international platform, and he can bring that kind of thought process in, and it really infuses enthusiasm into the team that was already here, really putting some great things together, really planning from our standpoint, that mobility as a service, that MOS timeline out in what we've done, what we're doing, and what we're going to do, and then having the team in place to do that, and letting them have enough reign to do it.
I'll say from our perspective, as soon as things started, like mid-March, I would say, our Mayor Jimenez, started having daily staff meetings with key departments. We'd get reports from the hospitals, and right when that was over, I'd have a daily staff meeting with my team. So engineering, operations, administration, HR, finance, IT, marketing, communications, everybody on there. And basically, we'd talk about everything, and everybody participated, and everybody was welcome to jump in with ideas, and somebody would run off and research this and run off, and it was really all hands on deck. And fortunately, we've had a team that has been together now for several years, and has gelled under other situations. We have hurricanes here every once in a while, so we're used to coming together for an emergency. So I think that collaboration and the trust that everybody has in their coworkers helped a long way for everyone to, there were no silly ideas. Anything and everything was on the table, and we had people willing to work around the clock. And these staff meetings were every day, Saturday, Sunday, an hour, 2 hours, whatever it took to deal with all of the new problems that popped up on that day.
Alice brings up a great point. I think one of the strongest management tools that we have is a common enemy. And, in COVID, we certainly all have a common enemy. And our team has done the same thing, Alice. We have Monday, Wednesday, Friday phone calls every week. And it's a big group. There's 30 people on that, 30 plus people on that call. The Trinity Metro, the Fort Worth Transit Authority, Denton County Transit Authority are also on the call. We invite them. So our entire team, and it really has brought the team together. And I know when we're all doing these virtual meetings, it's kind of hard to do it. But then what we really look forward to is Friday mornings. We do this call 7:30 Monday, Wednesday, Friday. Friday mornings, we have this theme event, whether it's family pictures in your back, for your background on your Teams call, or your vacation picture. And, so it takes a little longer to get through the call that morning. But not only do we cover all the COVID stuff that's brought us incredibly close together, but we infuse some personal stories in it, and it really has brought the team together. Probably much more so than if we had our meetings in the conference room and we come in and we do our business and we leave.
That's great. I think I've seen a lot of examples of where that's starting to happen, and it does depend on the culture of the organization. You've obviously already fostered it there, and it can flourish. We're nearing the end here. I don't want to be respectful of everybody's time, but I think we heard loud and clear from my question at the beginning that this actually is a time where we really should be innovating, right? This isn't a time to do nothing. This isn't a time to retrench. This really is a time to do different things. I think it demands it. And again, despite my bleak kind of introduction, we do know that transit matters, and if it's going to be healthy and competitive, we've got to continue to push the envelope. What, not to be unfair, but what's that around the corner? What's the next innovations that you all are thinking about? Is there something that's coming up? Gary, you mentioned maybe commuting patterns are changing in the future. Are there things we should be thinking about that are long-lasting changes as a result of all this?
Yeah, from our, and Alice touched on the high frequency routes earlier. I think the high frequency routes are going to be critical, but also how do you get to this? She said, how do you get to those high frequency routes? How do you provide that complete trip? And if I could show everybody my time frame, I'm not going to show you, Tina. You can't see all my secrets. But just the things that we're doing now. We've got our EMV pilot, which is the payment method, EuroPay, MasterCard, Visa. So we've got that pilot now. Our tap and app integrations, where we actually integrate the two accounts. We've got our API integrations with other private suppliers like Via, Lime, Jump, Genfare, and of course Uber, who we partnered with for some time now. All of those things are happening right now as we really pivot, and we're pushing hard to make this pivot. So while we're making sure, because the other thing that we've talked about is many transit agencies are having to cut back on service. And at the same time, the people that need transit most to get to jobs, now they're having to wait longer. So how do we fix that? How do we, trying to capture some of Tina's enthusiasm, how do we fix that and make this work best for our riders? And so at DART, we really believe it's combining the public sector and private sector and having a lot more on-demand service through the GoPass platform.
Well, in our case, there's another pilot we're bringing forward, and it stems from this need of getting people that are in these low-density areas to the high-frequency routes. So we're going to launch a pilot in several locations where basically it's a Circulator meets TNC. So we're going to have smaller vehicles, shuttle-sized vehicles, and you'll be able to, through an app, get a trip. And so the idea is that this is going to be a flexible route Circulator, and possibly a passenger on the app will be told to walk a block or two to meet up with other people for a pickup. And we're going to use that to bring people at first into our metro rail and our busway stops. And if that works well, it's something we'll deploy in other parts of the county. But basically, a lot of people need to use transit, and obviously it's convenient for those people that live, 3 or 4 blocks from a bus stop. But there are a lot of people here that don't, and we want to make it accessible for everyone. And the other thing that we're kind of sitting back and looking at this is like, well, we've always had a emergency operations plan for hurricanes. Well, this is teaching us that we need a resiliency plan for this and all kinds of other things we can't imagine yet. So we're going to take this opportunity to really think about other things that could come up that we should be prepared for, so that we can have other resources in place. Because really, a lot of what we're doing, we're fortunate that there are vendors in our community that could step up to the plate and help us, whether it was cleaning the vinyl curtains, the polycarbonate doors, but certainly there are other situations that we might want to stockpile materials for, or have other types of technology. So we want to think outside the box, what else we should be preparing for.
Tina, the last word is yours.
So I would say in closing, I just want to emphasize, and I think everybody on this, not only the four of us, but everybody who's listening in right now recognizes that it's our obligation right now to be using innovation, technology, data to make us more relevant, to make us more efficient. A company that we worked with at the RTC called Remix, and I know they work with a lot of people, the ability to very quickly analyze routes and to figure out, you know, how do we move, how do we pivot, again, to Gary, how do we get people to grocery stores and coming up with new route plannings very, very quickly. They created, I like this idea. They created, we don't compete with each other, right? All transit agencies, we're not competitors. So it behooves us very much to be sharing real time, to be sharing stories and successes and lessons learned as quickly as possible. So Remix created this Slack channel where all their users can kind of chime in and share their experiences. I think it'd be really fun to create a Slack channel, and maybe after Eno can do this for transit agencies, wherein we in real time can have these threads where we're sharing information about what we're doing. Are we collecting fares? Are we not? Is it working out for us? Do we have the homeless program? It would be really a problem. It would be fun to figure out how we use technology and networking to share those real-time problems. And I want to give a shout out. I was just reading this morning to Jacksonville. There's so many cities who are doing really fun things, you know, LA Metro, Kansas, Houston, Austin, Seattle. They're all doing really fun things to follow. But I was just reading this morning that Jacksonville partnered with a company called GoTux. What was it? GoTuckin. So it's those tuk-tuks are what, but they've got engines. They look like oversized golf carts, and they're using them. Normally, you would see them for, as tourists would use them in Miami than in other cities, but they're using now for microtransit, and I think that's going to be really fun to watch too.
A lot of amazing innovations coming out of Jacksonville, that's for sure. So
I know.
we can talk about that part all day. Again, we're just out of time, so I just want to thank you all very much for taking the time to. I know you're all very, very busy, to share your insights, to share your perspectives, and Tina, just to build off that last question, just those trying to figure out a way to communicate among each other, I think is really important. We've seen that there is demand out there. Yeah, well, we've seen it just from the participation in this, from the questions. There's a lot of interest in that, so thank you very much for that. And thank you all for participating. We didn't get to all of the questions. But they're going to have several more Eno webinars that are coming up this month. On August 11th, there's a webinar on the role of transportation in improving America's health. That's based on a recent Eno paper. On August 18th, congestion pricing's role in building a more equitable transportation system. On August 20th, best practices for incorporating racial equity into transportation planning. And on August 26th, efforts to address evacuation from disasters and emergencies amid the pandemic. Maybe Alice, that's one for you, I guess. So check out our website for all information on these and other webinars. That's www.enotrans.org. You also have a link to our YouTube page where this webinar and all the rest are archived. While you're there, check out Eno Transportation Weekly, a really invaluable source on all aspects of transportation policy. So again, Alice, Gary, Tina, thank you all very much for taking the time. Thank you for these insights. Thank you very much for participating. Please stay safe, everybody.
Thank you.
Thank you.